Have you ever felt like you need to go to the bathroom, but when you try, it's difficult to start or the flow is weak? Or perhaps you feel like your bladder isn't emptying completely. You might be experiencing symptoms of an underactive bladder. In this video, we'll delve into the causes, symptoms, diagnosis, and management of this often overlooked condition, helping you understand what it is and what can be done about it. Underactive bladder, also known as detrusor underactivity, can stem from a variety of underlying causes. Nerve damage is a primary culprit. This damage can occur due to conditions like diabetes, multiple sclerosis, spinal cord injuries, or even pelvic surgeries. These conditions can disrupt the signals between the brain and the bladder, preventing the bladder muscles from contracting properly. Certain medications, such as anticholinergics or antihistamines, can also contribute to underactive bladder by interfering with bladder muscle function. In some cases, the exact cause remains unknown, referred to as idiopathic underactive bladder. To understand underactive bladder, it's important to know how the bladder works. The bladder muscle, called the detrusor muscle, contracts to expel urine. In a healthy bladder, this contraction is coordinated by nerve signals from the brain. In underactive bladder, the detrusor muscle either contracts weakly, not at all, or for too short a duration to completely empty the bladder. This can be due to damage to the nerves controlling the bladder, or dysfunction within the muscle itself. The result is incomplete bladder emptying, leading to urinary retention and a host of associated problems. The true prevalence of underactive bladder is difficult to determine due to variations in diagnostic criteria and the fact that many individuals may not seek medical attention for their symptoms. However, it is thought to be more common than previously recognized, especially among older adults. Factors such as age-related nerve degeneration, the increased likelihood of having conditions like diabetes, and the higher usage of certain medications contribute to the increased risk in this population. While underactive bladder can affect both men and women, it may present differently and be associated with different underlying causes in each gender. The symptoms of underactive bladder can significantly impact quality of life. Common signs include difficulty initiating urination, a slow or weak urine stream, straining to urinate, a feeling of incomplete bladder emptying, frequent urination, getting up at night to urinate more than usual, and nocturia, and urinary incontinence, particularly overflow incontinence, where the bladder becomes so full it leaks. Some individuals may also experience a hesitancy or intermittency of the urine stream, where the flow stops and starts unexpectedly. Diagnosing underactive bladder typically involves a thorough medical history, physical examination, and a series of diagnostic tests. The doctor will ask about your symptoms, medications, and any relevant medical conditions. A post-void residual, a PVR measurement, assesses how much urine remains in your bladder after urination, often using a bladder scanner or catheterization. Urodynamic testing, including cystometry, measures bladder pressure and function during filling and emptying. These tests help determine the strength of bladder muscle contractions and identify any nerve-related issues. Other tests, such as urine analysis and imaging studies like ultrasound or cystoscopy, may be performed to rule out other potential causes of urinary symptoms. While there aren't strict classifications or types of underactive bladder in the same way as other bladder conditions, it's often categorized based on the underlying cause. It can be described as neurogenic, meaning it's caused by nerve damage, or myogenic, meaning it's related to a problem with the bladder muscle itself. It can also be described as idiopathic when the cause is unknown. Understanding the underlying cause is crucial for guiding treatment strategies. The management of underactive bladder aims to improve bladder emptying, reduce symptoms, and prevent complications. Treatment options vary depending on the severity of the condition and the underlying cause. Intermittent catheterization, where you insert a catheter to drain the bladder several times a day, is a common and effective way to ensure complete bladder emptying. Medications, such as bethanechol, may be prescribed to stimulate bladder muscle contractions, although their effectiveness can vary. Electrical stimulation therapy can also be used to stimulate the nerves that control the bladder. In some cases, surgery may be considered to address underlying anatomical issues or improve bladder function. Lifestyle modifications, such as timed voiding and double voiding, can also be helpful in managing symptoms. While it's not always possible to prevent underactive bladder, certain measures can reduce your risk. Managing underlying conditions like diabetes and multiple sclerosis is crucial. Avoiding medications that can contribute to urinary retention, if possible, can also be helpful. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can support overall nerve and muscle function. Regular pelvic floor exercises, also known as Kegel exercises, can help strengthen the muscles involved in bladder control. The prognosis for underactive bladder varies depending on the underlying cause and the effectiveness of treatment. With appropriate management, many individuals can experience significant improvement in their symptoms and quality of life. Recent research is focusing on developing more effective medications to stimulate bladder muscle function and exploring novel therapies like sacral neuromodulation and stem cell therapy to restore nerve function. These advances offer hope for improved outcomes for individuals living with underactive bladder. Always consult with your healthcare provider for personalized advice and management of your condition.